And we conclude with Kevin Westlye, who has been with us before, many years in the industry. I think we've never talked about what you were doing. You must have, did you own a restaurant?
I owned the Franciscan restaurant at Fisherman's Wharf for 10 years.
Isn't that something?
And I worked for Bill Kimpton for 5 years before that. So,
well, without digressing again, I got to finish. You're the director of the Golden Gate Restaurant Association, and you're now thrust into the national spotlight, as you knew might happen, over the health initiative proposed and enacted by the board and the mayor that hits your membership, the restaurant owners of San Francisco. For those, let's just update everybody real quick on what happened and where we are.
We're litigating the employer mandate section of the ordinance only, which we feel is totally independent from Healthy San Francisco, which is the healthcare delivery system. We won in federal court in December of 2007. The city is appealing that decision in the Ninth Circuit Court of Appeals, and the oral argument for that was last Thursday, the 17th, and we're now waiting for the panel of judges' verdict.
You won. And you won, I didn't realize that you had won, and you won obviously based on ERISA. Now, why don't we explain what that is and how it impacts this health initiative?
ERISA is the Employee Retirement Income Security Act of 1974. It was actually a joint effort of labor and business to try to come to agreement through congressional order with how to provide health care in this country. Right now there's about 130 million Americans who are voluntarily covered by their employers for health care. And this particular litigation seeks to uphold the employer's choice of who to cover, what to offer, and how much to pay for it.
The other dimension being, if I understand it, ERISA is also, in this particular way, trying to avoid a patchwork of dozens of different health insurance requirements or retirement, not retirement benefits, I don't know if it's retirement benefits. Is there anything having to do with, in other words, if you had one in Chicago, one in Los Angeles, one in San Francisco, it becomes so cumbersome that it should be a federally based system.
Think of yourself as a director of human resources for a national company, and you want to have efficiency in your medical benefits plan for your employees. If you had one standard that you chose as a company to offer, a PPO, an HMO, or Kaiser, whatever it might be, you could administrate that and your employees would understand it. But think about if 100 cities and 100 counties in this country had their own set of rules, how difficult the administration would be. And clearly the company would end up spending money on administrating benefits rather than on the benefits themselves.
You said here in one of your other visits, and it's obvious that you were very passionate about the fact that you believe in the need for some kind of universal coverage, and you also believe in healthy, creating more emphasis on being healthy rather than just, medical care, hospital care. Am I right? You were actually an advocate, or something that you're advocating for. So the intentions are good, and it's obviously part of the presidential race that some kind of they're moving that direction, would you say?
We can look at this locally. Healthy San Francisco is really an organization of the preventive care system, the healthcare delivery system through the clinics, not-for-profit and public. And we totally support that because it will lead to better patient outcomes. However, the employer mandate is not necessary to fund that program and is burdensome for small business. At the national level, I think if we have leadership in Washington, D.C. that wants to challenge the problem of universal health care, they need to do that at the national level, and part of that will be to rewrite the ERISA laws.
Right, but in other words, there's pressure at the state level, at the California state level, to create the same kind of universality of health care. You have the city of San Francisco, and I think other cities have now followed in California around the country. But you can't, in other words, you're saying you can't have all these different programs. It's best to be handled at some kind of national level or some way that streamlines it for especially small business people and mid-sized companies. Large companies have tremendous programs because of economics of scale.
Imagine yourself trying to negotiate your benefit plan when the person who was trying to sell you the plan knew exactly what you had to spend per employee.
Yeah.
There would be no efficiency whatsoever. One of the downsides of the employer mandate and of Healthy San Francisco is it's not nearly as reform-oriented as we had hoped it might be. And so hopefully anything that's done at the national level will be sweeping reform, taking a look at pharmaceutical cost, insurance company cost, and kind of balancing the system for patient delivery of health care.
Because the local initiative was really more towards exams and treatment than necessarily long-term pharmaceutical care or whatever.
Well, it is clinic care. It's not insurance, it's not dental, and it's not vision.
Right.
So I think it falls short of the mark, and it's more expensive than a reasonable health care policy would be. So I think it fails that test as well.
It had to be your organization, the Restaurant Association, although I have reprimanded other small businesses privately for not supporting you more aggressively because they're benefiting from what you're doing. You went out there, you've stayed with it. Even I wondered whether you would stay with it or they would find some way to buy off the Golden Gate Restaurant Association. But you're now headed, probably because of the wackiness of the Ninth Circuit District, to the Supreme Court. You're probably headed towards the Supreme Court. Now, we talked about this. You asked for some relief from the U.S. Supreme Court when they enacted a stay. You wanted to stay, but they allowed the city to proceed with the program. You wanted to wait until this thing was resolved. You went to Justice Anthony Kennedy. Mm-hmm. He said no. Is that an omen that the Supreme Court... does that say anything about how the Supreme Court would look at this case?
I think it says very positive things about what the Supreme Court would say about this case. The city applied for an emergency stay order allowing them to implement the healthcare spending mandate, and the Ninth Circuit, in their wisdom, allowed them to do that. So there is a stay order allowing them to introduce the law, even though it's been ruled illegal.
Even though it's been ruled illegal by...
the Judge White, who's a federal judge in court. So what we did is we petitioned Justice Kennedy, who oversees the Ninth Circuit, and asked him to accept our petition to look at overturning that emergency stay. The fact is that he accepted our petition in 2 days, which is highly unusual.
I see.
He gave the city a week to respond, and the day after they responded, he denied our petition. I think the message there was without comment, by the way. Mm-hmm, mm-hmm. So this is conjecture. One thing, I think he sent a very strong message to the city and to the Ninth Circuit that they're already watching this case. And secondly...
Why do you say that, Kevin? Well, what did you see in that action to suggest that they're cautiously watching this?
The fact that the Supreme Court accepted a petition on a short-term emergency stay request is extremely unusual. Mm-hmm. In fact, I imagine they accept one of those less than once per year. So this is a very unusual
thousands
step.
Of cases, right?
Thousands of requests.
I see.
And I think the fact that there was only 6 or 7 weeks between the time of the implementation of the stay order and of oral argument is really very little time for the United States Supreme Court. And I think one of the main reasons they probably didn't rule in our favor is it was such a short timeline.
When do you if the Ninth Circuit were to issue a decision right now, how quickly could this wind up in front of the Supreme Court? It would have to be next year, obviously, because the session is...
I'm very optimistic that we will win the decision in the Ninth Circuit, and there will be no necessity to go to the Supreme Court.
Even with the Ninth Circuit? Okay, good. Well, I'm glad that you're optimistic. And the main thing is that a lot of cities... a lot of industry people and a lot of business owners are looking at you. By the way, do you get contributions? Are people helping you to move this along financially, or do they just send you a lot of congratulatory emails?
The bulk of the funding is coming from the restaurant industry and from our members. There have been some other industries that have helped, but it's really a minimal share.
And I gather that you have a new friend of the court. The Bush administration is now, are they providing some kind of support in terms of a friend of the court document?
Actually, we received 9 amicus briefs and amicus letters in support of our position from a variety of national associations, the most important of which was from the Department of Labor. And there's a couple of legal issues. A refers to ERISA prong and a connects with ERISA prong. and interferes with the ERISA prong. And the Department of Labor wrote a very strong amicus brief.
Does that affect the Ninth Circuit?
I would assume that the federal government telling federal judges in a federal court that this is clearly an illegal ordinance.
That's pretty impressive then, isn't it?
I thought it was great when they, not only that, but they flew out a senior attorney, and we ceded 10 minutes of our 30 minutes of argument to that attorney, who then presented the Department of Labor's legal position, which was very strong, and is reinforced with decisions from the Ninth Circuit as well as from the United States Supreme Court.
Great job. I personally am very, very proud that you continued it because of the pressure you were under. We're running out of time, but what I had wanted to ask you, and in the time we have left, are your members beginning to feel the impacts, the smaller restaurant owners, in anticipation, I guess, already they have to put money aside starting this month. They have to start putting money aside for their employees. But the economic downturn that's occurring coincidentally at the same time, which hits restaurants anyway because it's discretionary income, are you seeing impact now from your membership already?
Yes, and I think it's a combination of things. One more ordinance that adds enormous cost to a labor-intensive industry. The economic downturn is certainly, dining out is considered a luxury buy,
Absolutely.
And so people are cutting back in order to pay their bills. And we've seen things like flour, corn, and rice prices triple in the last 3 months, which is a staple of almost any cuisine, as a lot of that product that's produced here now, and corn is going into ethanol, and a lot of the wheat and the rice are being exported to China and India because of the value of the dollar is so weak.
And you have the minimum wage, which is another mandate.
With no tip credit, yes.
No tip credit. You have now the sick leave that was mandated upon San Francisco small business and business owners. I mean, are we near a point where it's a tipping point for a lot of these restaurants saying, I just cannot make it?
I think that we may be just past the tipping point, but we won't know that for another year or two, because for restaurants to just give up and close their door, the restaurateur has signed a personal agreement to pay the lease and probably pay their equipment leasing package. So until they hit the first option in their lease, they will struggle to stay in business in order not to go personally bankrupt.
Yeah.
I think people on the bubble are really struggling, and I think that the shift toward quick service is a trend that we'll see. And frankly, that's not going to support tourism in San Francisco long term, not to have dynamic full-service restaurants.
You think so? You think that the quick service is not a viable substitute?
No, I do not. I think it
certainly
works.
Not for going dining on at night, but for casual.
It works for
casually.
People who work in the city. It works in the neighborhoods.
Yes, it works.
But it certainly doesn't work as a world-class dining destination concept.
I'd like to have you come back. We'll know a lot more next time, and I want to talk more about the industry, about the restaurant industry, from your background at the Franciscan, especially.
Great.
Kevin Westlye, thanks for being with us.
My pleasure.
Congratulations.
Thank you.
And thank you for joining us, and we'll see you next time. Visit our website.